Imagine a world where the cost of essential medications is significantly reduced, making healthcare more accessible for everyone. Starting January 1, Australians will benefit from a substantial decrease in the maximum price they pay for prescription drugs under the Pharmaceutical Benefits Scheme, PBS, which will now be capped at just $25. This change marks a return to medication prices not seen since 2004, a time when many Australians were less burdened by the costs of their prescriptions. The federal government has enacted a new bill that lowers the general co-payment by $6.60, bringing the previous maximum of $31.60 down to this new, more affordable rate. Health Minister Mark Butler expressed optimism about this development, stating, "This will make a huge difference. It's obviously good for the hip pocket, and that's important. But it's also good for your health." This sentiment underscores the dual benefit of the policy. Not only will it ease financial strain on families, but it will also encourage more individuals to seek necessary medical treatment without the fear of exorbitant costs. According to the Australian Bureau of Statistics, approximately 1 in 13 Australians chose to delay or forego filling a prescription in the 2023-24 period due to financial constraints. This statistic highlights the pressing need for affordable medication, and the recent reduction in co-payments aims to alleviate this issue. Previously, the Labor government had already made strides by lowering the maximum co-payment from $42.50 and freezing the cost of prescriptions for pensioners and concession card holders at $7.70 in 2023. This latest adjustment is expected to provide even more relief to those struggling with medication costs. The PBS has long been celebrated as a cornerstone of Australia's healthcare policy, receiving support from major political parties. However, it now faces potential challenges from international pressures, particularly from the United States. President Donald Trump has proposed imposing a staggering 200% tariff on pharmaceutical imports to the U.S., a move that has raised concerns about the future of Australia's drug subsidy scheme. The powerful U.S. pharmaceutical industry has been vocal in its opposition to the PBS, and there are fears that this tariff could be a bargaining chip in trade negotiations. Despite these threats, both major political parties in Australia have firmly stated their commitment to protecting the PBS. Minister Butler reiterated the government's position, emphasizing, "We are determined to protect our PBS. It's served this country well for 8 decades, and we will not be negotiating on those elements." However, when pressed for more details about the U.S. tariff plan, he admitted that clarity from the Trump administration has been lacking, stating, "The honest answer to that is no." As we look ahead, the commitment to maintaining affordable medication through the PBS is crucial for the health and well-being of Australians. But here's where it gets controversial. Will international trade pressures force Australia to compromise on its healthcare policies? What do you think? Should Australia stand firm on its PBS, or is there room for negotiation in the face of global economic challenges? We invite you to share your thoughts in the comments below.